So hello everyone. This week we have done these three operations, and this operation is a coronary artery bypass grafting, commonly known as CABG operation. And this gentleman has come to us in a very bad shape. It was a critical LAD disease, and he was having unstable angina and chest pain off and on. So we took him on a emergency basis, and within 2-3 days we have got his Aishman cleared and operated upon him. And this is a commonly known as a bypass operation, which we have done successfully. Today is the first post-op day, and he is recovering well, and everything is fine. It looks like his heart is protected, and he is going to do well for coming at least 20 years. And if we would have not operated upon him, his whole myocardium was in jeopardy, and he might have had a very bad outcome without the operation. This is the beauty of bypass operations, coronary artery bypass operations, which are very beneficial. This way, this is the most studied operation in the literature, and the benefits of CABG is reflected for a middle-aged man at the age of 50-55 year of age. If he is getting this operation successfully done, so it's going to add another 15 to 20 years to his life, and by the time the longevity, he will complete his lifespan of 70 years. So this is the aim of this operation, and the ultimate goals of this operation is to have a good angina free, pain free life, and it adds to the longevity of life. So it's a well operation done, and we are doing these operations quite often, and he's getting benefited under the Ayushman scheme with the help of all our healthcare professionals, anesthetists, paramedical staff, and the nursing staff are doing very well, and the results you can see on the face of the patient. And this is how we are reproducing our operations to the society, so that the diseased heart, the people with the diseased heart, will go back to the society with fruitful days, and they will contribute back to the society. Another operation which we have done is a aortic valve replacement. It's a bicuspid aortic valve with great calcification, and you can see he is showing you the pacemaker which we have put, because he was a sick sinus syndrome to begin with, and previously also he got admitted off and on because of his low heart rate. And so we have planned this aortic valve replacement and elective pacemaker in this patient, but somehow we couldn't get the pacemaker, and right now we have put a temporary pacemaker, and Ayushman scheme is getting approved for a permanent pacemaker, and ultimately he will go with the permanent pacemaker, and that is how the solution is Mr. Yadavji. And he's doing very well. He had a very tough course during the operation and in the post-operative period. Somehow God is great, and he's now doing well, waiting for his permanent pacemaker approval to come, and after that we will put a permanent pacemaker, and I think he will be all right for coming time. We have put a tissue valve here, and he will not require any blood thinning medicines in future, and he will do well. They are all the patients from the remote area of Jharkhand, a very poor patient, unable to afford anything. So government has this Ayushman scheme under the Pradhan Mantri Swasth Suraksha Yojana, and they are getting best benefit out of these. Otherwise, these costly operations, the people are unable to afford it, and somehow with this scheme we have done so many operations, and this is the beauty of the government who has introduced this scheme, which is very beneficial to the real poor people of this country. And I hope this is one of the very good government scheme. And another operation we have done is a mitral valve. You can see the happiness on the face of the son. He is introducing his mother, who has undergone a tissue valve replacement of a mitral valve, and a lot of clots were there in the LA, and somehow we have operated the patient in time, and Otherwise, the clot could have embolized and gone into brain or some other vital organ of the body, and she would have landed in some sort of cerebrovascular accident, something like that, But somehow we have cleared everything, chopped off the left atrial appendage, and replaced the valve with a tissue valve. The idea of putting the tissue valve to all these people, because they are for they are from villages and far-flung areas where the adequate facility of PTIN or other type of monitorings are not available, and they are not very compliant patient who will take medicines on the daily basis. So what we do, we usually put tissue valves in these patients, so that we just give small dose of aspirin and a very very small dose of anticoagulation in the form of acetram or warfarin, so that the things go on without any medicine, and it's the beneficial effects. Thank you very much. Bye bye. Have a nice